The new screening guidelines issued by the Preventative Services Task Force of the Department of Health and Human Services recommend against routine screening mammography in women 40 to 49. They would scale back screenings for women 50 to 74 to every other year. These new guidelines have drawn opposition from women and physicians across the country. I'm CM Winters Palacio, and we debate this controversial publication in this installment of The Professors.
From across the city and the 7 city colleges of Chicago, broadcasting from 63rd and Halsted at Kennedy King College. Professors take the art of conversation to a higher degree.
Meanwhile, the timing of publication, in the midst of a healthcare reform debate about reducing medical costs, has raised eyebrows. Could the research be aimed at cutting costs at the expense of women's health? And how does this proposed reform impact women who live in our poorer communities? While some cancer groups, including the American Cancer Society, have objected strenuously to the panel's recommendation, Susan G. Komen for the Cure, the worldwide advocacy organization, is aiming for a more measured, strategic tone. To provide our viewers with the best information from both sides of the debate, we have invited Mary Maryland from Malcolm X College, who is also the president of the Illinois Division of the American Cancer Society, Dr. Christy Davis from Olive Harvey College, Mr. Joseph Harrington, Assistant Commissioner at the Chicago Department of Public Health, and Adele Langham, a breast cancer survivor. Welcome all. So, Mary, what is the controversy behind this new guideline?
The controversy really is changing the age at which women should begin to get mammograms. Previous guidelines have been to start at age 40. The new guidelines or recommendations from the task force would have a woman not begin to get mammograms until age 50, and that's a significant change.
Now, the new guidelines, in addition to changing the age, it's also every other year. The current guideline is by age 40. Is it also every year, or?
It is annually currently.
And so now it's 50 to 74 every other year?
Yes.
Okay. And so you're saying that there's this controversy by pushing the age back because of the high risk? Tell us about that.
These guidelines actually are specifically, all these guidelines are for the woman of average risk. A woman of higher risk would definitely consult her provider in terms of when she should begin mammograms and the frequency with which she should have them. However, these guidelines pushing the age back to 50 excludes an entire decade of women having access to mammograms, and we know that mammography saves lives. And so you lose that opportunity with these new guidelines.
Yeah, I think it's important to point out that the American Cancer Society guidelines specifically start at age 40 for women, and there's no cutoff in terms of when annual mammograms should stop. And these guidelines really are different than what women have historically heard about. And I know that publicly we spent a number of years getting women to understand the importance of routine annual mammograms, and so these recommendations do fly in the face of what women have become accustomed to.
Adele, you are a breast cancer survivor.
Yes.
So if you don't mind me asking, how old were you when you were diagnosed?
I was diagnosed when I was 51. I had had a mammogram when I was 50 in November. I was diagnosed in August of the following year. So if I had to wait 2 years, my outcome would have certainly been different.
Part of me is concerned, just looking at the whole debate of the healthcare debate. Is this, I'm watching from home. I'm not a physician. I'm 39, I have not taken my mammogram yet. But I'm looking at this, and Dr. Davis, I'm watching this and I'm saying, wow, the timing. The timing of changing this guideline along with the healthcare reform. And my fears of taking this test, because my girlfriend has taken it. She's described it to me, and though we have, you know, laughed in the gaps of our fear, this is pretty huge.
It is.
So how do we deal with that? How do we navigate all those emotions?
Well, one thing that already exists prior to even the changes that are occurring in the health reform is emotional stress that many people experience in regards to, especially in regards to breast cancer, for going to get the annual exam and things of that nature. And one of the other issues that already exists is the psychological stress of not getting it, and then being diagnosed. So with the new guidelines that are on the table, I think that will pose even a higher increase in regards to the emotional and psychological stressors, to women. And, it's definitely through research and statistics have noted that African American women are at the height of breast cancer, unfortunately. So now we are looking at it in regards to the health reform, as you noted, and also in regards to the community mental health, in regards to access to that, which has also declined. So there are a number of issues at hand in more than just one area, but it's still stemming from that one breast cancer, concern.
Yeah, a very important point was made about mortality. African American women nationally are much more likely to die from breast cancer than other women, but they're less likely to get breast cancer. And that's something that we've been trying to understand for years. I don't think we have a complete understanding of it, but it's something that we know for a fact. So from the standpoint of mortality, African American women do have the highest risk relative to breast cancer. The other thing when you talk about healthcare reform, what's really significant about these recommendations is who they target. And they really target the industry, and they target people that are providers of healthcare. These are not really guidelines for the general public, but as such, they are guidelines for the insurance industry. And I think the concern moving forward is the grading system they have for women under 40 and women 75 and older. It's likely if the healthcare bill as is currently authored, that these services would not be paid for, would not be covered by insurance moving forward, just based upon the grade they've been given by these recommendations.
And these guidelines just simply further discourage women in our community that are currently not getting their mammograms, not doing their self-exams, and if we don't do that, we are dying at far faster because we're being diagnosed at 3rd and 4th stage. And that's a problem.
Now, in your diagnosis, what was your diagnosis?
I was first stage, stage 1, grade 3. Grade 3 being the highest grade that you can get. That means that it's growing rapidly. But I was stage 1. I found my own lump in my breast doing a self-exam.
And prior to the age 50, because I'm getting around the age 40, so...
I had been getting my mammogram since I was 40, every year, annually, absolutely.
Okay.
But here's the thing, when I was 50 and had a mammogram, it did not detect the tumor. The ultrasound did not detect the tumor, but I did my own self-exam. That's when it didn't take long to manifest itself.
Now,
and these guidelines also speak to the efficacy of self-breast exam. I think Mary could speak to that too. I mean, it does.
They're absolutely necessary.
Well, I'm not saying that they're not necessary, but again, this is based upon evidence, and what they would say is there's not enough evidence to substantiate or support.
Well, there's variability in
and that's
how
what they do say.
Self-breast exams are done. There's variability in how clinicians teach women to do self-breast exams. And so what the American Cancer Society would say, we should take a look at, are there ways to have women learn to do it more effectively?
Yes.
But I'd like to revisit, if I could, just for a moment, the issue about mammography in general. In the 1980s, we had about 13% of women getting mammograms. Tumors were caught at about 3 centimeters. In the 1990s, we increased to 60% the volume of women getting mammograms, and the size of tumors found was decreased to 2 centimeters. For those women in the 40 to 49 age group, I think those results are impressive, and we don't want to go backwards. And so the American Cancer Society does continue to recommend that women follow their recommendations. Mammography beginning at age 40 and annually thereafter.